Good day everyone, I'm Rolando Macadini and I will be your student nurse for today. So now I will be performing the enteral feeding, which has three parts: the insertion, then the feeding, and then the removal of the nasogastric tube. So since most of the materials and equipments needed are not available, I will do my best to explain and widen your visualization as much as I can during my return demonstration. So what is the nasogastric tube insertion? So the nasogastric tube insertion, or the NGT, is inserted through one of the nostrils down the nasopharynx and into the alimentary tract. So the NGT are used for feeding clients who have adequate gastric emptying and who require short-term feedings. So the purpose of the NGT is to administer tube feedings and medication to clients unable to eat by mouth or swallow a sufficient diet without aspirating food or fluids into the lungs. Then to establish a means for sanctioning stomach contents to prevent gastric distension and nausea and the vomiting. Then to remove stomach content for laboratory analysis. Then to lavage or wash the stomach in case of poisoning or overdose of the medication. So, the equipments needed are the NGT FR size 16, the non-allergenic adhesive tape, 2.5 cm or 1 inch wide, then clean gloves, water-soluble lubricant, facial tissues, then 2250 ml catheter, tip syringe, basin, stethoscope, disposable pad or towel, then safety pin and elastic band, and then clamp or plug. So, the first procedure is verify the physician's order. Then review client's medical history, explain the procedure to the client, then prepare the equipments and supplies needed. Then raise the bed and place it in high polar position, 60 to 90 degrees. Then cover the chest with towel. Then wash hands and put on the clean gloves. Then assess the client's nostrils with pen light and have the client blow nose one nostril at a time. Then using the NGT tube, measure the distance from the tip of the nose to the air lobe and then to the cyber process of the sternum. Then mark the distance on the tube with a piece of tape. Then lubricate the 4 inches of the tube using water-soluble lubricant. Then ask the client to slightly flex the neck backward. Then gently insert the tube into the nares. Then ask the client to tilt the head forward once the tube reaches the nasopharynx. Then if the client continues to gag, stop for a moment. Then advance the tube several inches at a time as the client swallows water or the ice chips. Then withdraw the tube immediately when there is a sign of respiratory distress. Then advance the tube until the tape mark in reach. Then wipe or wash the oil at the tip of the nose and allow to dry. Split and then split a 4-inch tape lengthwise. Then secure the tube with the tape by placing the wide portion of the tape on the bridge of the nose. Then wrapping the split ends ground the tube. Tape the cheek as well if desired. Then check the placement of the tube. Then attach the syringe to the end of the tube and rapidly inject 30 cc of air and at the same time auscultate over the epigastric area. Then aspirate for gastric content, assess the color and quality of the content. If required, measure with pH indicator slip. Then prepare the client for X-ray, check up if prescribed. Connect the distal end of the tube to sanction draining and adapter according to the purpose of the procedure. Then secure tube with tape with rubber band and the safety pin to client's gown. Then dispose contaminated materials in proper container. Then wash the hands. Then position the clients comfortably. Place the call light in easily reach. Then return tube to its original height position. Then using clean gloves, provide the oral hygiene and assess client to clean nares daily. So let's move on to the nasogastric tube feeding. So what is the NGT feeding? So it is the administration of the gastrointestinal or the enteral feeding via nose directly into the stomach with the use of the gastric tube. So what is the purpose of the NGT? So the purpose of the NGT feeding is to provide feeding to then to aspirate gastric contents, then to administer medications, then to administer supplemental fluids. So what are the equipments needed? So the equipments needed are the prescribed amount of enteral feeding, then the stethoscope, then the aseptic syringe, then the gloves, then the 30 cc of the distilled water for flushing, and the enteral tube size 16. So what are the procedures? The first procedure is to check the physician's order. Then the second, assess the bowel sounds. Assess the client regarding discomfort from the tube, then observe insertion site of irritation, then prepare the tube feeding at room temperature, then obtain articles or equipments needed, then identify the client and explain the procedure, then place the client to high Pollard's position, then check for tube placement and patency, then infuse feedings, then pinch proximal end at the feeding tube, then attach syringe to the nasogastric tube, then fill the syringe with measured amount of formula, then release the tube and hold the syringe at 12 inches above the tube point of insertion into the client, then repeat until the prescribed amount had been given. Then instill 30 ml of water into the nasogastric tube, then clamp the NGT before all of the water is instilled. Then ask the client to remain in Pollard's position for at least 30 minutes after the feeding. Then do aftercare equipment, then wash hands, evaluate client's tolerance of feeding, then evaluate client's response to the tube feeding, then observe client for complaints of nausea and vomiting, then record amount, type, and time of feeding, then document client's response and tolerance to the tube feeding. Then lastly, the removal of the nasogastric tube. So once the nasogastric tube output is less than 500 ml over 24-hour period with at least 2 other signs of return of bowel functions, the NG tube will be removed. Other signs of bowel functions include flatus, bowel movement, change of the NG tube output from bilious to move clearly protic character. So the equipments needed are the disposable pad or towel, then tissues, clean gloves, basin, 50 ml syringe, then moisture prop trash bag. Then the procedure are verify physician's order, gather all equipments needed, explain the procedure to the client, elevate bed and assist client on high or semi-Pollard's position, wash hands and don disposable gloves, then place disposable pads over the client's chest, then give emesis basin and disposable tissue to the client, then attach shoring and flush tube with 10 ml water, then carefully remove adhesive tape from client's nose, then instruct client to take a deep breath, clamp tube with piners by doubling tube and itself, then quickly and carefully remove the tube while client holds breath, then clean and dry the face and nose of the clients and perform hand hygiene, then dispose tube and other equipments properly according to the hospital policy, then remove gloves and wash hands, then document the procedure. And then the enteral feeding is completely done. Thank you.